dies from a stroke every 4 minutes in America, according to the Centers for Disease Control and Prevention.
But stroke death rates in most of the Mississippi Delta region are above the national average. Many residents live more than 45 minutes from a hospital that is stroke certified. WMC Action News 5 investigator Jessica Jaglois visited Coahoma County, Mississippi, which has one of the highest stroke death rates in the state, to learn what's being done to bridge the great health divide.
So I want you to follow my pen with your eyes, please.
Dr. Muhammad Hadidi is a neurologist in Clarksdale, Mississippi. People in this area die of strokes at a higher rate than most other places in the U.S. The stroke death rate in Coahoma County, where Clarksdale is located, is 101.2 deaths per 100,000 people, while the national average is 72.6 deaths.
Most of the stroke I see here comes from chronic illnesses, diabetes and hypertension.
The rates of diabetes and hypertension, or high blood pressure, are high in Coahoma County. In fact, most counties in the Delta region have higher incidence of diabetes, cardiovascular disease, and strokes. A stroke occurs when blood supply is cut off to the brain, most commonly by a blood clot, or when a blood vessel in the brain bursts.
Seconds counts because all studies have shown that the earlier we intervene, the better the chance of recovery from the stroke. I see a patient as young as the 30s. They're in a wheelchair because they didn't get the proper intervention for their stroke.
32% of Mississippians live more than 45 minutes from a hospital certified for stroke care, according to analysis by Kaiser Health News and Investigate TV.
It definitely matters.
Dr. Jonathan Wilson is with the University of Mississippi Medical Center, which has an emergency referral center called MedCom. Mississippi EMTs can call the MedCom Center to find out where a patient should go based on hospital bed availability, traffic, and a patient's symptoms.
Our local hospitals and EMS providers know where the resources are. So when they interface with a patient and pick them up on a 911 call, they know where the most appropriate place will be to take the patient.
Mississippi also designates levels for stroke centers on a 1 through 4 scale. A level 1 stroke center is able to provide critical care to the most serious stroke patients. There are only 3 in the state. Northwest Regional, where Dr. Hadidi is located, is a level 3 stroke center, which is capable of diagnosing and stabilizing patients who then need to be transferred to a level 2 or 1 facility. The nearest level 1 facility is an hour and a half away in Memphis.
Dr. Hadidi says when having a stroke, seconds count, not only when it comes to saving your life, but also the quality of life you'll have after you survive.
Not able to walk, not able to talk, not able to use their arm.
With such limited resources available statewide, level designations and MedCom are both crucial, says Dr. Dan Jones, also with the University of Mississippi Medical Center.
This is organized in a way to be sure that within that magical 3-hour period of time that every person in every state, in every area of the state has an opportunity to receive that care. And
Dr. Jones says a lack of access is a big issue for Mississippi stroke patients, but so is a lack of awareness.
People who are less educated and less informed are less likely to be aware that if they have certain symptoms, they need to call and get help and get an ambulance there quickly.
The signs of a stroke include sudden numbness or weakness, especially on one side of the body, confusion or trouble speaking, trouble seeing or walking, and sudden severe headache.
Close your eyes, please.
Dr. Hadidi says stroke survival depends a lot on how quickly help is called, but
if you look at the big picture, if you want really to make a difference, I would say you focus on lifestyle issues here in the Delta.
To help prevent your risk of a stroke, you can try lowering your blood pressure, losing weight, and exercising more. For more tips and to find certified stroke hospitals in the state, go to our website and click on this story. For the investigators, I'm Jessica Jaglois.